More than 70,000 patients with osteoarthritis in 7 countries on 4 continents have already been treated with a program for which she and her team won the Value-Based Healthcare Prize in 2019. It is her passion to advance the frontiers of knowledge to improve the quality of life of those with musculoskeletal disease and to improve healthcare delivery for these conditions. Her research findings are the result of teamwork and long-standing collaboration across medical professions. Professor Ewa Roos is professor at and one of the founders of the Center for Muscle and Joint Health, Department of Sports and Clinical Biomechanics, University of Southern Denmark. She has published more than 250 articles, and we could call her the Queen of Physiotherapy. She will enlighten us with her view on the importance of exercise for the regeneration. Please welcome on stage Ewa Roos.
Why am I here? When I look around, I'm not sure that I fit in, because I'm not a man. I'm not a surgeon. And for that reason, I have a feeling that my message may be somewhat uncomfortable. But I am a big fan of regeneration and treatments that support the body's capacity to heal. My many years in research have confirmed what I suspected already when working as a clinician, that surgery is not always needed when you have a knee problem. You can actually get comparable results with exercise therapy. Treating with exercise therapy can save many common knee surgeries, their costs, and their associated risks without compromising the results. So why am I here? I'm here to inspire you to think differently when you develop future treatments for people with knee problems. Because neither surgery nor exercise are perfect treatments. So there is an absolute need for better treatments. I grew up academically at Department of Orthopedic Surgery. That is a very powerful and executive environment, and I loved every inch of it. It made me feel very important to be part of this environment. So we saw young athletes who had torn their ACL, we saw middle-aged people who had ruptured their meniscus, and we saw older people who had developed osteoarthritis. And you could see the expression of hope on their faces when they were presented with the option of having surgery. Because they wanted and they thought they would get their old knee back, and so did I, and I'm sure so did the surgeon. So this feeling of hope is very powerful. It's actually so powerful that fake surgery has been shown to be just as effective as real surgery. And one way you can fake surgery is to make skin incisions and never insert any instruments into the joint. So here you can see the result, the improvement from real arthroscopic partial meniscectomy. 30% improvement on a group level. And what about fake surgery? Well, 30% improvement. No difference between the two groups. I have always been a runner. It's an important part of my life. It makes me feel very good. Many years ago, I suddenly developed what felt like a locked knee and became a patient. That was devastating to me. I remember I couldn't bend the knee enough to step up from the street to the sidewalk. And I couldn't care for my kids the way I wanted to. It affected my whole life. And I was diagnosed with a meniscal tear. And I was offered surgery as part of a study. That study included that I would have to leave the operating table, work out on a Stairmaster with cords sticking out from the knee joint, before going back to the table and finish off the meniscal surgery. That sounded so awful that I decided not to have the surgery. Despite not being able to live my life the way I wanted, and despite having to say good morning to the surgeon every day, who got more and more desperate in finding patients for his study. But much to my surprise, I got better after a few weeks. My mechanical problems resolved, and I could return to running and a normal life without surgery. This was in the mid-90s, and I started to question if knee surgery really was necessary to resolve mechanical problems of the knee. Because if you see a meniscal tear on MRI or in the arthroscope, and you see the flaps and the pieces that can be hanging there and can come in the way when the knee moves, it feels pretty obvious that you need to do something surgically to fix it. And this is a really convincing story, but is it true? So we do studies where we let chance decide if people are treated with exercise therapy or with surgery. In one such study, we included people who were diagnosed with a meniscal tear. So prior to treatment, we asked them how much problems they had with mechanical or other symptoms like catching, clicking, pain bending, swelling, and stiffness. And 25 to 60% had at least moderate problems with these symptoms. We asked them again after treatment, and they were much better. It was a much smaller proportion who reported having these problems. And guess what? This is in the group that was treated with exercise only and did not have the surgery. So I think it is time to bust the myth that surgery is needed to resolve mechanical problems of the knee. Let's talk about ACL injury. This is a devastating injury that most commonly happens to young athletes. For nearly every other, it is a career-ending injury. And for those who do return to sport, many of them injure themselves again. And this is the fate of those who have had their knees surgically reconstructed. This is myself, together with Richard, Harold, and Stefan. 2 orthopedic surgeons, 2 physical therapists. Together, we have suffered 3 ACL injuries. We led a study where we let chance decide if young athletes with an acute ACL tear were treated with reconstructive surgery, followed by exercise, or by exercise only. This is a very controversial and complex question. And it took us more than 10 years from first thinking about it until the results were published. And then we celebrated with champagne. I think we needed it, because we experienced many barriers along the way, including the first young surgeon coming on board being so harassed that he quit the project and became a hand surgeon instead. And the second young researcher who came on board and actually finished the project, he was never invited to any conferences to share the results. So what were the results that no one really wanted to hear about? Well, we found that after treatment, 9 out of 10 have improved. They feel better. But actually, only 5 out of 10 feel good about their knee. And for 1 out of 10, the result is so poor that they feel that the treatment has actually failed them. But the controversial finding was that there was no difference between the two treatments, surgery or no surgery. Osteoarthritis. That imposes a huge burden on the individual and on the society. It's very common. It's more common than other chronic diseases, such as diabetes and cardiovascular disease. And we often think about osteoarthritis as a disease of the elderly. But if you had a major knee injury as a young athlete, actually about half of them develop osteoarthritis already in their 30s. But thankfully, there is a good treatment for advanced stages. You can replace the joint with metal and plastic. And this is really, really a good treatment that has improved the quality of life for millions and millions of people all over the world. It has been considered senseless to try the effectiveness of total knee replacement. It has been considered just as senseless as testing if you need a parachute to survive if you would jump from an airplane on a high altitude. Because after all, joint replacement is one of the most significant advances of the 20th century. And don't we already know that they are effective? Well, we thought there was the need for this parachute trial. So we let, again, chance decide if mostly overweight and obese people with advanced osteoarthritis, either all eligible for surgery, either have their joints replaced with metal and plastic, followed by a 3 months rehabilitation package, or have the rehabilitation package alone. The rehabilitation package had a focus on exercise, but there were also other components. So people were taught about osteoarthritis as a disease and what they could do themselves. Those who were overweight and obese got to see a dietitian, and the surgeon could prescribe analgesics and orthotics if they thought that would be beneficial for the patient. And what did we find? Well, we found that the results were not as clear-cut as we had expected. We found that if you have the surgery, followed by rehab, you can expect a greater pain relief. It's actually so large that 85% find it clinically relevant. But it comes at a price, because 1 out of 10 experience a serious adverse event, mostly blood clots and infections. Most of these can be resolved very easily with additional surgeries or additional hospital stays. But they can also lead to lifelong consequences and even death. If you, on the other hand, only had the 3 months rehab package, you also experienced a pain relief. And quite surprisingly, it was large enough for 68% to find it clinically relevant. And that was enough for 3 out of 4 overweight and obese people with advanced osteoarthritis to postpone surgery for at least 1 year. And at 2 years, still 2 out of 3 patients had not had the surgery. And there were no serious adverse events. So in summary, common knee surgery is unfortunately not as effective as we would like it to be. And surprisingly, exercise therapy is much more effective than we thought it could be. Exercise has many benefits for people with knee problems. It can improve joint stability in those with an ACL tear. It can reduce mechanical symptoms in those with a meniscal rupture. It can relieve pain in those with osteoarthritis. And in all knee patients, it will improve the function and the quality of life. So better treatments are needed because common knee surgery or exercise therapy have their benefits, but it's not good enough. You need to develop new and better treatments. And I would like to encourage you to include the power of exercise into these future treatments. Because exercise is powerful and our bodies are amazing. It can actually be enough, even for an ACL-injured athlete, to return to tough sports. Meet Dino Djubic, who is an Australian soccer player. He tore his ACL and decided he wanted to return to sport without having it reconstructed. So he had everyday intensive physiotherapy and exercise therapy for 2.5 months, and he returned to play at 5 months. But just as Dino says, recovery and return to sport after an ACL injury, that's not only about the knee, it is also what's in your head. So I have a little confession to make. This is me. And because of our studies, I choose exercise therapy when I tore my ACL a few years back. And interestingly, preliminary results from our current research shows that the ACL actually can heal in those who do not have the surgery. Maybe I'm among those. I don't know. That's another story. Thank you.